So we enter level 2. What do you enter it with? Trepidation, excitement, or something different?
Oh, look, I'm entering it satisfied. I think the fact we've got here in just, about 7 weeks is fantastic if you compare what's happening internationally. Not only have we turned this thing around, but we're coming into it with really good numbers. We're coming into it with a really clear sense of direction from here about what's needed to happen. So I'm satisfied, and I'm also satisfied we've got the testing and contact tracing capability to identify if we do get any resurgences.
Good. Let me come back to that in just a couple of moments. Yesterday's 0. How much of level 3 is in the results now?
Oh, I think we are now seeing level 3 results, and the reason I'm assured about that is not just the fact we've been in it for over 2 weeks, but we have kept the testing up at high rates right around the country, and we're not uncovering these sort of unknown pockets of infection.
So when you say testing, there's 2 lots of testing, people going down to the doctor. Are you still doing random testing? If so, how much, and what are you finding?
Yeah, we're still doing not so much random because we're picking out particularly groups that would be at higher risk, people who've worked in or are working in hospitals, the folk that have been staffing the community-based assessment centres, staff who work at the airport. So yeah, we're keeping that testing going, and we're just not finding anything, which is good, and we're going to keep doing that.
Is there no community transmission then?
Well, I think it's hard to say no, but it is. I can say, look, there's a very, very low risk now because we've done over 200,000 tests. Some, yes, on people who were symptomatic, but some, and particularly over this last few weeks, asymptomatic people just as part of surveillance, and we're not uncovering infection out there in the community.
So as you go out and look and you see nothing, and as we get zeros each day, and there's nobody coming into the country, and there's only 70 active cases left, that's virtually elimination, isn't it? I can walk out today and go pretty much anywhere, and short of running into those 79 people, be relatively confident, can't I?
Yeah, people can be confident, but the key thing here is, as we've seen, and just in the last couple of days in China and Wuhan, where they had no cases for quite some time, now they've got 6 cases, and their response is, in typical Chinese fashion, is very significant. However, we don't want that situation here where we're losing, where we drop our vigilance, where we drop our guard, and it gets away on us again. It doesn't mean it's not out there. So we've got to just make sure we're maintaining those baseline public health measures.
Would you expect to see numbers rise?
They may. It's hard to say. So we're just going to have to keep an eye out really carefully and see if there is any infection still out there.
See, in Germany, they've seen numbers rise, but they say they're not worried. The R rate's the key. Somebody said this morning, I was reading 1.2, 1.3, you worry for several days in a row. Theirs at 1.1, they're not worried about. Is that a reasonable approach to be taking?
It is a reasonable approach. Our modelling suggests anything under 1.2. So you can go just above 1, but as close to 1 as possible. So under 1.2 is good. But the key thing here, of course, also is Germany and those other European countries are opening up when they know they've still got quite a lot of infection out there. We're not in that position. So we're in a very good position here.
Those funerals in the last couple of days, how did you cock that up?
Well, I don't think we cocked it up so much, Mike, as actually we went for consistency on the group size and the funeral, and in fact we used the benchmark, which was what we had funerals at during Alert Level 3. So we went for that group of 10 for the first 2 weeks, then review. And that was the one area where we did get a lot of feedback. And I immediately got some communication from the Funeral Directors Association. So yesterday we got on, in the room virtually with them. We worked out how it could be done safely, and we found a solution. So that's our job. I'm really pleased we got that.
But you could have done that to start with. I mean, it's been a bad couple of weeks, can I suggest, with that plus these compassionate cases, which you've also had to reverse in some circumstances as well. Not enough heart to start with, perhaps.
Well, I don't think that. I think it would be bad if we were just digging in and standing our ground. Actually, what our job is to engage, listen, and again on the compassionate leave one, we had already initiated a process to review the criteria that we used and how we went about that, and to speed it up. And we've done both those things. So I'm really pleased we've improved that process, and I'm very pleased we've worked out a solution with the funeral directors and with Māori for tangihanga on the marae to increase that number up to 50.
All right, appreciate your time. Ashley Bloomfield, Director General of Health.